name is Francisca Nwokocha. I'm Evercare. My operations now heart failure. Now a changing valve. Now October 5th. When I the surgery, I'm
Mrs. Abigail Emeribe, a sister to Francisca Nwokocha. I'm here in Evercare Hospital. Actually, my sister is a life testimony. She has been suffering heart failure for long, which we could not discover is when we get to Evercare through a doctor that directed us to here, and we met a doctor, Dr. Augustine Olugbemi.
My name is Dr. Augustine Olugbemi, Cardiothoracic and Vascular Surgeon here at Evercare Hospital Lekki, Nigeria. I met Francisca, a 43-year-old female, sometime in August last year, 2022. She was suffering from gross heart failure. Her feet were swollen, her tummy was swollen, she couldn't breathe, she couldn't walk any distance, even at rest she was breathless. And she was sent from the east. She actually came to Lagos because of this problem.
Along the line, we started the procedure for the surgery. When they told her it's a major operation, they will do the operation in 1 week time. We are in one hospital. Ending of September, they directed us to this Evercare Hospital. So when we came here, so my sister saw the hospital, she likes it. When we come inside, actually we saw what we want. Before they started the procedure for the surgery, they booked us appointments. After that time, they booked us another one for tests and other things, echo, all and all.
We did an echo, which showed that her heart actually was failing. The mitral valve, one of the valves in the heart, was diseased, wasn't working properly. And certain muscle, there's a muscle that separates the left ventricle from the right ventricle. That muscle was thickened. It was huge. So it wasn't even allowing a lot of blood to go from the left side of the heart to the circulation.
After I said the surgery, I'm 1 week. I do the one is there now, next one is there.
After the surgery, she stayed like 1 week because she was responding fastly. Before the surgery, they told us if she responds very well, that she will go before. It's exactly that 1 week that she was discharged.
We prepared her for surgery. Sometime in October, she got ready for the surgery and we took her in for surgery. We replaced that diseased valve, the mitral valve, we replaced it with a mechanical valve, and that muscle that was thickened, we reduced the muscle so the blood can flow better through that valve. She did well after the surgery. She was taken to ICU, CCU, where she was managed. She was there for about 2 days, and then she was stepped down to the ward. Altogether, she was in the hospital for about 7 days, after which she was discharged. Yesterday, I saw Francisca 3 months down the line after the surgery. She's been fine, she's been doing well, and she's returned back to her normal life. She's very grateful that things have gone well.
The hospital, Mama, I like him.
According to what my sister said, she loves the hospital. Even me, I so much love Evercare Hospital. Immediately we came in here, all our mind was at rest and we got what we want from Evercare. Especially I want to thank Dr. Olugbemi for his care over my sister's health. Even I do send him texts because he's out for us throughout the surgery. I didn't even expect it because I didn't know him from anywhere. It's when we got here, as in what he did for her life and the assurance he gave us that with God, the successful will be a successful one. And for God may have it, it was successful and she's okay. She's better now than before. So I just want to thank God Almighty for what he did in her life.
Even though it's a specialized case, these cases can be done in Nigeria. And we are glad to have you here in Evercare. We have the facilities, we have the manpower, and the environment is okay. So many patients don't know that these things and these cases can be done here. You really don't need to travel out of this country for cases like this. So we do open heart surgeries and so many other complex surgeries here. This week, Francisca will be going back to the East, back to join her family, happy. I'm glad to tell you that she is doing well. Thank you very much.